Good afternoon, everybody. Good afternoon to the Secretary of IAS, our next Secretary of IAS, and dignitaries of CAS and WO, and the delegates. So I'm going to talk on meniscus balancing. The message is meniscus balancing should not be taken very lightly because it's not a very simple surgery, and long-term impacts are there. So you should be very sincere while doing it. You should plan it properly. So we all know the anatomy, like tree or plantation, we should always try to preserve meniscus, but not at the cost of the reoperation or other complications. What are the functions of meniscus? As we all know, it provides stability because of its cupping effect. It provides joint lubrication. It acts as a shock absorber. It acts as a load bearer, and it deepens the cavity, resulting into stability. Menisci is 80% avascular. So this is the point. So the role of meniscus repair is there, but you should be very judicious while repairing meniscus. So I am not in favor of excising all the meniscus, but you should be very careful while repairing meniscus. So what is meniscus balancing? Meniscus balancing is an appropriately done partial meniscectomy with as much preserved meniscus as possible with the rounded smooth edge so that it doesn't irritate the cartilage and doesn't cause any cartilage damage. And inappropriately and improper partial meniscectomy may be more detrimental to the knee joint than the not done treated meniscus injury. And at the same time, properly done meniscus balancing is much better than meniscus repair if done poorly and in unindicated cases. So the indications should be there for repair of meniscus, and you should be very clear which meniscus should be repaired and which should not be. So regarding types of meniscus, if you detect meniscus injury in early stage of tear, then the simple longitudinal tear which goes to bucket handle tear or simple radial tear which may advance to parrot beak tear. So these tears can be handled at earlier stage, leading to a less aggressive repair or if meniscectomy if needed. So again, the location of tear is also important. It may be peripheral tear where repair is more indicated, and when we move towards center, the meniscectomy is more indicated. So the indications being for meniscectomy or meniscus balancing, radial tears. Most of the radial tears are in the white zone, so it should be excised. Unstable flap tears, results of repair is not good, so it should be balanced or excised. Or longitudinal tear in white zone, it's because it's a vascular zone, and sometimes bucket handle tear when it's irreducible or it's a large tear from extending from anterior to posterior, better it should be excised. And if it's a complex tear having a mix of all those injuries, it should be better excised. There are some extended indications because we are living in West Bengal or even many parts of India. Because of coming of lot many schemes and Swasthya Sathi here, we have to go for balancing or meniscectomy because of some financial constraint also. But it has been proved by many literatures there is no benefit of meniscectomy or balancing in cases of degenerative tears and in the patients having osteoarthritic knee. So there is no role of debridement in such cases. So it's an art of meniscus balancing. It's an art. You should have very good instrumentation set. You should have very good thigh support. You should have pump or some alternative. And you must have very good instrumentations like angled scissors to reach the corners of the knee. You should have angled punched. And one instrument I found is angled cigar handle punch, which is very useful. So you should have these instrumentation to have a better balancing. So this is a simple flap tear. So the inferior surface of the meniscus is torn, and it's in the periphery of the meniscus or white zone, so better it should be excised. So in this case, I opted for excision or balancing of meniscus. So as usual, the flap is removed by the punch. And you should not be in hurry. You should take care of the cartilage and you should respect the other surrounding structures. And after you cut it by punch, it should be cleaned and it should be, the edges should be round by using a saver. So this is a typical posterior horn and body of medial meniscus. Although we can attempt for repair in such cases, but because this was a chronic tear and it was predominantly in the white zone, so I decided to go for meniscectomy. And this is the angled cigar blade. The point to be noted is you should not start with the torn part of the meniscus. You should start with the healthy part of the meniscus, like from the inner surface of the shoulder of the torn meniscus, and your instrument should come through 20 to 30 degree of angulation, so that you will have a rounded smooth margin at the end of the excision. So after excising anterior horn or anterior part, same principle applies for this posterior part. It should be angled 20 to 30 degree of angle, and then finally it should be shaved off to a smooth edge. This was a case of chronic meniscus, bucket handle meniscus tear, medial horn of meniscus, and it was irreducible, and even after I could reduce it, it was very unstable, and the extent of tear was from anterior to almost up to the root. So it was complete tear, so I thought this is not going to heal properly and it won't give a good result. So I excised it. Although I have a follow-up of 9 to 10 months, patient is doing well till now, but this is a very short-term follow-up. So I excised it, the principle being the same. So sometimes we have to excise such large bucket handle tear also. So to excise it or to shave it properly, you should have at least 3 portals anteriorly. And you should be ready to settle the portals for instrumentation and for other purposes. This was a case of lateral meniscus. Again, it was a small tear in the white zone, predominantly in the body of the meniscus, and I opted it for balancing and did in the same manner. So it should be, every meniscectomy case should be followed up by MRI, and long-term follow-up should be taken, and the studies are lacking with the exact long-term results of meniscectomy. Although we don't have a long-term follow-up repair as well at this point of time. So it's not conclusive which procedure gives what result. So take-home messages being, the margins of the balanced meniscus should be smooth, rounded, and there should not be any dog ears. Be ready to change portals and make accessory portals if needed. Surgeon signature. We heard this from our teachers that in our initial days, we used to do a lot of cartilage damage. And our teachers keep telling us that don't put your signature inside the joint. So don't do any harm if you cannot do any good to the patient. So this surgeon's signature or chondral damage should be avoided as much as possible and save the meniscus whenever possible. Thank you.